So, welcome back, everybody, to the second part of today's Partnership Board meeting. Our next item talks about the second of the ambitions we're looking at today, which is our connection to strengthening the local economy. And I'm going to invite Jen Connolly and Kate O'Connell to introduce this item. So, over to you.
Good afternoon, everybody. Hi, my name is Jen Connolly. I'm Associate Director for Improving Population Health, and I work jointly between West Yorkshire's Integrated Care Board and West Yorkshire's Combined Authority. And I'll welcome Kate to introduce herself.
Thank you. Yes, lovely to be here. Kate O'Connell, I'm the Director of Leeds Health and Care Academy and Strategic Lead for Health and Social Care Workforce in Leeds.
Thanks, Kate. So I'm really pleased to bring you this report this afternoon, which considers the ambition we have to strengthen and support the local economy. Now, perhaps this measure is one of our harder to measure, but we've endeavoured to present a fair overview of some of the work and evidence that we've used to assess ourselves against this ambition. We know that ICSs have got 4 key purposes, and much of that's been referenced earlier today. Improving population health outcomes, tackling health inequalities, enhancing productivity and value for money, and helping the NHS support broader social economic development. Now, I hope that you can see that this work does support all of those 4 ambitions, but is most squarely aligned to that fourth ambition. We're also very clear that economic and social development is clearly very much outside of the NHS alone, and it really requires this partnership approach, and much of the key responsibility sits outside of the NHS. But this paper wants to make clear that we recognise the roles of our VCSE, our local authorities, our combined authority, and obviously our business community in the region in that economic development responsibility. But coming back to the focus of the role of the integrated care system, I'd say it's less well articulated what best practice looks like around this ambition and this area. As mentioned, unfortunately, Amy's not able to join us today, but with thanks to Yorkshire and Humber Health Innovation Network and the Innovation Hub in West Yorkshire for really helping support us with the assessment on this one. So if I start with our areas around strategy and policy, part of this framework really thinks about how do we work with our partners in this way, how do we think about those other organisations who are leading on economic development, where's the alignment around our workforce strategies, where's the alignment around a green plan, and where's the alignment with local economic strategies. The evidence includes the strategic alignment that we've had that input to the local growth plan. So I was really pleased that Tracy was able to talk about that at the outset of the meeting and highlight the strength in that plan that focuses beyond just the industrial strategy and the key sector areas, but really recognises this two-way street with health and wealth. And the local growth plan in West Yorkshire includes health and wellbeing as a central theme. So we are working together to kind of get that relationship and that alignment really well articulated. In terms of the climate plan, we heard a thorough update on this in the March partnership board, so I won't go into much further detail there. And then on the people plan, we've had other updates, and we know that this is going to be refreshed. This brings together the way we work together, so we do have that evidence that work is being done. And as we head into that refresh, I think it's important that we keep this ambition clear and articulate that within the refresh as well over the coming months. Thinking then again about the section in the report about relationships, this, I think you've heard Rob's articulation of this at the outset of the meeting. The fact that this partnership predates the statutory obligation to have a partnership like this is evident that is front and centre. Those relationships are front and centre of the approach in West Yorkshire and has been for years. That's then been written down, that's been put into writing, first through the memorandum of understanding that the partnership developed, and then subsequently the partnership agreement that we've got with the West Yorkshire Combined Authority, and really gives us that strength to build on and to affect those complex challenges together. The good practice on relationships and partnership working can then be seen to kind of flow through into how we act on these, as well as the strategic alignment. And I've referenced in the paper the Work and Health Partnership. I know there are other good examples of good practice of partnership arrangements and partnership working across. That one was particularly relevant in demonstrating how we are working together to support this ambition. The Work and Health Partnership brings together colleagues from across the Combined Authorities Employment Support and Skills Agenda, from the ICB, from local authority employment and skills teams and public health teams, and our DWP colleagues as well, and has really enabled us to really understand and put some numbers against the challenges that we're facing in the kind of work and health related economic and activity challenge. We've been able to map out the current services that exist and identify the best practice. And through that work, we've identified we really need a work, health and skills plan that is built on the knowledge that we've gained so far, but more importantly, built on the voices of our communities. And we've commissioned CADA Research to support us with that. That's happening at the moment. That work, health and skills plan will be ready in January. Also wanted to flag that we are using all of the assets we hope available to us in the region, and working with the DHSC Health and Social Care Hub. We're going to be hosting a summit in December, which looks at good work and health, and really building on those relationships to influence national policy. Because we know in this sort of work and health space, we need to think about the protective factors, the policies, the good practice, the Fair Work Charter as an example of how we strengthen the amount of good work in our region. And it's brilliant that the Health and Social Care Partnership has signed up to that Fair Work Charter to put in place those protective factors, as well as then building on some of the interventions that we can act on together. I'll hand over to Kate, and she'll give you some highlights and examples around the sort of good practice that's happening around anchor networks and innovative recruitment that brings those strategies to life a bit, and really is how we've kind of evidenced and articulated the work that is under the frameworks banner of operations and delivery. So over to Kate for a moment, and then I'll talk a little bit more about research and innovation before opening up to questions.
Thank you, Jen. First of all, just really wanted to emphasise that point that Jen's made around collaboration. So I'm here on behalf of Leeds Health and Care Partnership, but I'm here on behalf of West Yorkshire, because we work as a real tight partnership across Workforce Place Leeds, and I'm delighted Kate Sims is here today, who is very closely involved in that sharing of insights, best practice, how we develop as a system. So at the heart of that, as Jen said, is the inclusive growth, and really understanding that link between health and employment. And I think we've been doing a lot of work in West Yorkshire to understand not just what that means in principle and theory, but actually how do you then apply that in practice? So we've got some really good examples from across the board in West Yorkshire, but I wanted to highlight in particular the work we've been doing around the Talent Hub in Leeds. This was a really innovative approach to hyper-local recruitment, and that's where it started, really working with very kind of local groups and community networks to understand where the opportunities could be for more diverse parts of our communities to actually get into health and social care work. It's evolved massively over the last few years in terms of where that started and where it is now. And we've really understood the importance of connecting not just job outcomes, but thinking about that whole journey from the individual's perspective. So really thinking about outcomes in terms of different destinations. So some people might need access to work experience, some people might need to get into volunteering, education courses, training, pre-employment programmes, specialist support if they have particular barriers to getting into health and social care jobs straight away. And supporting those individuals through a long-term journey, not just picking them up and trying to help them at one particular point in time, but actually staying with them on that journey, and helping connect them into the right career for them, rather than the gap that an employer is trying to fill. And I think that approach has really paid dividends in terms of the retention rates we've seen through that approach, which are consistently above 90% for people after 12 months in those roles. So hugely important in terms of diversity, hugely important in terms of health equity, and thinking then about how they thrive in those roles. So over 50% of those people have been long-term unemployed, who are supported through that approach. And what we see with that is that as they get into the rhythm and kind of pattern of employment, it raises other challenges. So actually it's thinking about how we support them as individuals, but then what our organisations can learn from them in terms of adapting for the wider workforce as well. So it has driven quite considerable system change, and we've seen some really positive steps in terms of challenging us as employers, us as educators, us as kind of social players in our city to really think differently about what's important, where we start, and how we measure success. So it isn't always just about numbers, but actually what learning do we take from individual stories. We've got a great case study which I'll pop in the chat for you to have a look at in your own time, but it just really for me brings to life that power of partnership, and recognising that we don't just operate in isolation. Even within a small geography, we've got to look broader than that. So finally, I just wanted to emphasise that link with health equity, because as Jen said, it's not just about getting people into employment, but actually thinking about inactivity even once people are employed, and the risk of people falling out of employment due to that, the challenges that they face. So really starting to focus our work much more in that preventative space with our workforce. So our workforce in health and social care is are members of our communities, they're members of our population as well. So really understanding their experiences and the challenges that they face. And quite frankly, if we can't provide some good support through health and social care as employers, then I think we've got a real stretch for broader sectors to try and tackle what are really quite tricky challenges. So we've got some great partnerships evolving with public health colleagues and with our specialist services beyond the NHS into VCSE and other places as well. And we're starting to look at how that can really impact the longevity of people in employment and helping people maintain that active engagement. So Jen, I'll hand back to you.
Thank you. And just to finish highlighting some aspects from the report, if I focus on that research and innovation section of the report, Tracy talked about this at the outset of the meeting, a real strength in West Yorkshire. And we've been both growing the infrastructure around research and the way we do that and the way we bring research into policy and practice through things like the West Yorkshire Scientific Advisory Group. But then also in the innovation space, really acknowledging the role and contribution of health tech in our regional growth plans, but then how we do that together. The West Yorkshire Innovation Hub really supporting us in bringing those things together and creating that ability to work together on some of the complex areas here. I think it's just worth probably flagging some of the numbers involved as well. Yorkshire and Humber wide, over 1,000 companies being supported, and we know the strength in West Yorkshire in that. And then over 140 million in funding leveraged into the region. But notably in West Yorkshire, we've heard some reference to the brilliant work already underway. But the Innovation Campus, that's over 7.5 million. We're really seeing that contribution very tangibly in some of these respects as well. So that's just a little overview of the report, and the report is just a bit of an overview of the amazing work that's underway. But I hope that it highlights some some of the things that we've used to kind of understand where we are against this ambition. It also highlights the challenges and opportunities ahead. But I think what we've seen suggests that we are really well placed collectively and as a region to take on those opportunities, and we really welcome that in West Yorkshire. So we're really primed for that, working together in this space. The recommendations suggest that we then look at each organisation or each place may want to do a bit of a self-assessment against that maturity framework as well, and there's some proposed sort of next steps for areas to consider when they're undertaking those individual reviews. So the recommendations are more for how areas may want to work together to take this even further, rather than specifically for this partnership to act on today. So I hope that's clear in the report, but I welcome questions. Thank you.
Thank you very much, both of you. And that's prompted quite a few questions and comments. So we'll start with Tracy.
Thanks ever so much, Tim. Oh, what an amazing report. Congratulations. Really detailed, and the power of the collective, drawing all of the pieces together for that jigsaw. So do pass on my thanks as well to Amy, who's not on this call. Brilliant work. Thank you. Very good to see the health tech strategy in there. And as I mentioned in my opening remarks about being in North America, banging the drum for West Yorkshire, this isn't just about Leeds. I mean, Leeds is a shining example of how we can work collectively together. But if health is wealth, and if innovation helps us get healthier, and we know, don't we, everybody on this call knows that if you're on, for example, a unique drug or a drugs trial, your outcomes are better. We want to make sure that we are the centre of innovation in pharma and also in data and devices and all of that other good stuff that we do, but also that workforce with my responsibilities and devolved powers over the adult education budget of 67 million, working with you, identifying where those great jobs can come from. And the work and the pilot that you did, was it in Lee Green? Is that the right place? I'm speaking to the
Lincoln Green.
Lincoln Green, sorry. Yeah. That community engagement is fantastic, but it doesn't have to be limited to just Leeds. And being able to fund those courses to train people to get into health roles, I think, is a unique opportunity. And it's something that I've been, passionate about in my correspondence to the Minister about health tech and about our unique partnership. And really pleasing to see Pinpoint mentioned in the report. And they were one of the businesses. There were several. EMIS was another one, but several people who came on their trade mission who were really bowled over by the support that they'd had from us. It's a blood test, a cancer blood test that's really quick, that can diagnose really quick whether you have a propensity to cancer. And the way that the US market really did welcome that sort of collective approach and how we supported the innovators and new businesses. So I just want to say, Jen, this is honestly how we grow our economy. It's so much part of our growth plan, as I spoke to at the beginning, because it's our area of specialism, but it must not only be limited to the big metropolitan hospitals. It can cascade round across the whole of West Yorkshire.
Thank you. Liz?
Yeah, thanks, Councillor Swift, and thank you for a brilliant report. It was really good to read it and all the great work that we've going on across West Yorkshire. So I'm the chair of Kirklees Health and Care Partnership. Really pleased that we've had quite a few mentions of a health innovation campus that's sitting in our area, and that will start to do a lot to encourage growth in jobs and also growth in small businesses. So I suppose that the point I wanted to raise was the section we've got here on research and innovation. I think we do a great job in West Yorkshire of bringing in funding for businesses. We've got the Mayor's Launch Pad. We've talked about SBRI and Innovate UK funding in here. The Health Care Innovation Network runs accelerators as the Leeds Academy. So we've got all sorts going on if you're at that stage of being a business. And we know we've got products and services coming through that will meet needs in health and care. So my point is about, can we track those businesses actually as they come into contact with health and care services and have to get commissioned into practice? Because I think that is really tough for them. And we're asking the paper to support the Health Innovation Network a bit more. And I wonder if it's something we could look at, because those businesses will grow jobs. If we're putting products in place that meet a need, which is what we need to do, we need to be making sure that in all our organisations and networks, we're welcoming to those businesses, we pay them on time so they can sustain the jobs and employees, and that they can thrive in our area as well as outside the area, because sometimes they will look outside, think, oh, it's easier to get commissioned somewhere else. So I wonder if that could be a twin track, so we encourage them, and as well as being sort of a hub for these businesses, we're a hub for these businesses to grow and make a difference to our population as well.
Thanks, Liz. I'll bring Fatima in and then come back to you, Jen, if there's anything you want to respond to so far. Fatima?
Thanks, Chair. So firstly, I just want to share my thanks to Jen in particular, who is absolutely embodying the importance of a health and care partnership collaboration. And this is just one of many examples of this shared way of working already delivering dividends for the region. I mean, one of the things that comes across really well in this paper is that West Yorkshire is a region for opportunity and possibility. But we need to make sure that that works for everyone. So recognising the fact that data tells us that people on the lowest income are disproportionately spending a lot of their income, 1/3, on their housing, of recognising that 3.7 million people nationally are living in substandard housing are things within our gift. But if we want people to move out of homes like that and be able to buy their own home, then this economic plan is crucial to that becoming a success. But if we're truly wanting it to be inclusive, then we need to recognise the fact that not everybody has the same experience in the workplace. So the Fair Work Charter is a massively innovative product that addresses and offers some solutions when it comes to equalising employment, but there's also something about us recognising and harnessing some of the good products that we've developed in West Yorkshire in that space, things like the Working Carers Passport, or the work that we're doing with people with learning disabilities, which encourages them to go into the workplace. And the reason why that's important is because I went to a visit in Bradford recently with Bradford People First, and there was a gentleman called Damien who approached me in the wheelchair and sort of talked to me about his experience of applying for a job. So he went to his local Tesco and said, you know what, I'm really looking for opportunities. I'm really keen to try and get a job. And he was told that there was no jobs available for someone like him. Now, that is not the response we want to hear from our businesses in West Yorkshire. But I suspect what the issue is that people are focusing on what people can't do rather than what they can do. And the work skills agenda is instrumental in making that a reality and supporting businesses to get the most diverse talent. Because if we've got diversity of thinking, then our organisations will be far more innovative than they ever can be in that space. Another element is really supporting networks to make this a success as well. So we convene, and I'm going to shamelessly plug it, the Women of West Yorkshire Network, which is really supporting the skills agenda for the region. And I just wonder whether there are opportunities for our places to create subsets of those opportunities too, to make it feel really relevant and meaningful for people in the grassroots of our region. And we know from the work that we've done on race equality as well, that if we truly want our organisations to be inclusive, then we need to advocate and recognise that our society is unequal. And I think this is the first step to recognising the problem, but more importantly, doing something about it.
Thanks, Jen. Do you want anything you want to come back on before I bring in some more people?
Thank you. Really value everybody's comments. So, and I think what I've heard through those comments is that there's even more great practice happening and routes to help this agenda grow even further than we can possibly have captured in that report, which I totally recognise. I think Liz, on your point around how we kind of go on to support businesses even further, that's definitely a kind of ambition within the health tech strategy and within the work that the health innovation the innovation hub do. We do try and meet quite regularly to kind of think about how we do that even better. So welcome your the ideas that you've mentioned already. There's some of the suggestions you put in. If there's examples that we can use that help us unblock things even further, please do let us know, and I'll certainly share those with Amy and colleagues there. In terms of kind of opportunities for all, I do see that Kate's got a hand up as well, which so I'll welcome Kate's comments on the people plan and how we kind of take that aspect forward. But I think it's brilliant that we have some good practice from our NHS organisations like the Working Carers Passport that we can share through things like the Fair Work Charter, because we through that Fair Work Charter there are growing groups of either sector or size or geography, businesses coming together to share what good practice looks like among themselves. So some of that is happening very organically, and some of that we can continue to shape by sharing our own good practice as well. So I think really well made. But I think Kate will be coming in to talk, hopefully touch a little bit on the people plan as well, and thinking about those recruitment practices and retention practices and the opportunities for all within that. Thank you.
Thanks. Yeah, so Kate next. Yeah.
Thank you, Councillor. It's Kate Sims here. I'm the Director of People for the ICB. I'll keep this fairly brief because obviously I know other people have got their hands up. But firstly, a big thank you to Jen and to Kate. I think this is one of those papers that every time you read it, you could learn something else. I was fascinated with all the links and the good practice. So it just gets you really thinking in terms of opportunity. Jen will not say this, but she came to the West Yorkshire People Board in its last meeting and really presented about the strength of this work, both the Work and Health Partnership, which it's one of my favourite meetings, if I'm honest. We really get into some good discussions, and also the Fair Work Charter. And that has led Kate's reference that strength of the 5 places. And indeed, most of the workforce place leads, we're putting the hands up to say we want to work even more closely than we are with Jen and colleagues. So I think it's indeed this Friday that we've got a bit of a get together, a coming together of us all to say, how can we support this work, but also, what is it we're doing in each of the places that is already aligned from that perspective. The people plan, the people strategy for West Yorkshire has been touched on a few times today. It is due for its refresh because it concludes in 2025, and some colleagues on the call are aware. Doing a short review at the moment about, where are we, what's it achieved and all of that. But certainly from February onwards, we are doing some quite significant engagement across West Yorkshire, across all of our sectors, because for me, it's your people strategy. It's not mine. So I will want to work closely. One of your requests I saw in the paper was, could we ensure that the work you're doing here is reflected and really strongly aligned? I think this will be one of our key priorities in the West Yorkshire People strategy. So just to quickly finish by saying you've absolutely got my support, and we'll make sure that alignment is really evident and strong. So thank you.
Brilliant. Kim?
Thank you. Is my sound working now?
Okay. Yes.
Oh, great. Okay. Kim Shuttler, I'm the VCSE lead on the ICB. Thanks so much for the reference to the VCSE in your paper, Jen, in terms of really recognising the vital role that it plays in terms of the local economy. I thought it'd be useful to remind people about our sign up to Keep It Local, both as the first Keep It Local ICP in the country, and also our 5 local authorities are signed up to it. We've talked about it at this session before, and just by way of a bit of update, we've had some really great conversations in terms of contracting and procurement within the NHS, which have really highlighted that, of course it is about getting the money to people in communities as close as possible. However, there are some very tangible things that we could be doing in terms of the way in which we procure and contract the VCSE, which would make a really, really big difference to what those organisations could be doing, not in terms of surviving, i.e. not closing, but also the contributions they could be making in the local economy. So I wonder whether, what might we do collectively across the partnership to accelerate that work a bit more, so that we're really, so we've got this work going on within the ICB, but we're really making sure that we bring that together with the local authorities and the combined authority to keep that West Yorkshire pound in West Yorkshire and make sure that we're making the most of the money that we do have. Some of them are quite quick fixes, I think. We just need to all sort of, on this call, if everybody got on board with it, it could make a huge difference.
Thank you. Selena?
Hello everyone, I'm Selena Douglas, I'm the Chief Exec from LCH. Just to add to what colleagues have said and just to build on a couple of points. Great paper, love the paper, and isn't it important that people have a good job, somewhere decent to live, and what huge impact that has on their health and their life ambition, and isn't that fantastic? And I think there's been inroads that we've had, like hyper-local recruitment and getting people into the health service by doing local targeted work. What I would say is that, and I know we've got a paper later on about it, and Fatima actually raised it as well. I suppose what I'm worried about is just the fact that that is often concentrated in some of our lower bands within the NHS. And it's about how do we then join together and think about how we're giving people the same opportunities and life chances. And if we could capture children at a young, that sounds like a bit of a child catcher. I don't mean it like that at all. If we could get children when they're younger, wouldn't that be great? And one of the things that I think we do need to look at in terms of how we looking at making sure our workplaces are friendly for all of the protected characteristics, but in particular, as we all know, we've seen a huge uptick in neurodiverse referrals, and I'm challenging myself to think about if 25% of my workforce in 5 to 10 years time are neurodiverse or are neurodiverse now, how are we making our workplaces friendly? Because that is something that's going to be so important to us in terms of getting those great skills into our organisations and really harnessing people. So I think there's some great work happening. Let's make sure it's not just at the lower bands in any sector, whether that be the NHS, social care, or in the voluntary sector. Give people real ambition, and how we really making sure our workplaces are as inclusive as they possibly can be as part of this, I think, are things that I just like to build on.
Thank you. I'll bring Rob in and then come back to you to finish, Jen. Yeah.
Thanks, Chair. Just a plug for firstly the people connection. Just to remind everybody that our health and care staff in West Yorkshire and in the wider region have a 1% higher sickness rate than the England average. You might think that doesn't sound like much, but that's 1,000 more people off every day in West Yorkshire because of that difference. So if we were able to make our workplaces more inclusive and our staff less unwell, then they would contribute more and they would be able to provide more care, which would provide more support to people, and it's a virtuous cycle. And you can extend that into our population being unwell and therefore less economically active than elsewhere in England. So the value of the health and care system to the economy and the approach we take to our staff can both be meaningful on this agenda, and we should highlight that, I think. Second connection to make is we do have a memorandum of understanding with the Association of British Healthcare Industries and with the Association of British Pharmaceutical Industries to ensure easy and secure partnerships. And I think we could make more of that in the paper and make sure we keep that in our heads with the work that we're doing. And then the third is just to recognise the substantial investment in capital that there is in our hospitals and health system over the next 3 to 5 years. So if we get all of the sums that we expect, we're looking at close to £2 billion. That plays out in most places. So Brendan's on the call, he's got another 150 million, 180 million or so coming his way. For Luki, I can see on the call, guaranteed at least 600 million, but it should be more. And that funding is part of the New Hospitals Programme and protected. We need to recognise there's a risk around the innovation hub in Leeds and the innovation arc, because with the capital developments in Leeds are part of a review, and the more that we can use mechanisms like this around the economic as well as the health care benefits of that investment, the better. And then, as we said before, Bradford District Care Trust getting 50 million or so for its developments. If we look at all that in the round, it's a substantial sum which will help the economy. And Brendan and his team done some fantastic work on the social impact and social return on those investments. So I would really keen for us to recognise that firstly as an opportunity, but also we should all recognise the risk that there is at the moment to some of those investments.
Thanks very much. Jen, I don't know if there's any final comments before we finish, or Tracy, do you want to?
Yeah, just to say on that investment, I've raised it in every single meeting I've been in because, we're underway. You may have heard that Angela Rayner, the Deputy Prime Minister, did say 5 million was going to the investment zone in our region. So some of that has kept everything alive, but we're really making the case that this is part of our future growth. So if you want growth, you have to keep that investment.
Thank you. Jen, any final points you want to respond to?
I think not much more to add to what's been said, but really acknowledging the additions that have been made where we could strengthen the way we describe this work even further. So I really value everybody's contributions there, and just on the hospitals in particular, as well as the way that Tracy's picked that up. I just to reference that we are going to be re-establishing a healthy hospitals network where we can really focus on some of the great practice there and the opportunities that have been mentioned too. So I think there's a mechanism for strengthening that a bit as well. Thank you.
Thank you. So thank you very much for the paper, and thank you everyone for the contributions on it. I'm very happy to endorse the work, and just to re-emphasise the point about encouraging each organisation to look at using that framework to evaluate their own contributions. Thank you. So the next item is West Yorkshire Local Transport Plan. Tracy, I know you've got to leave shortly, but do you want to make any quick comments before I bring James in?
Thank you so much. We all know that our transport network isn't as good as it could be in West Yorkshire. It's holding our growth back. And the transport plan is an integrated plan that is going to take mass transit and also the bus network and active travel and have a whole strategy for the region so we can get our workforce to work, but also to bring investment because we've got a skilled workforce and opportunities and people can move about. Why can't we have that London-style transport offer that you see across the country and not here in our region? So this is a great opportunity for us to co-develop it with partners between obviously ourselves, but the district partners and local authorities. It's going to be adopted. I mean, the Transport Strategy 2040 was adopted in 2017. I mean, that's like Neolithic era, isn't it? It's so far, back in the past. So we need a new plan with a new vision, and it's going to be submitted for adoption by myself as the mayor in March 2026. For now, we want to keep working with you, understanding what needs to be done, engaging with partners, members of the public. For over 4,000 people took part in the consultation for mass transit. That's now closed, and really exciting to see such positive feedback. But that's only one part of the jigsaw. And there's also a statutory consultation period in 2025. We've got to have a sustainable transport network and provide that clean and safe and healthy West Yorkshire where people can get about and be encouraged to cycle and to walk as well as to jump on public transport. I've got to take a call at 4:00 to talk to the LGA where I'm speaking tomorrow. So I'm on my briefing. But James is on the call, hopefully, and there'll be any comments, or you can always just feed them back in the chat or an email if there's anything, if you'd like to see the plan or if you'd like to see any details about it. Very happy to take quick questions now, but anything more detailed, do reach out.
Thank you, Tracy. James or Jen, anything to add in introducing this?
I'll just hand over to James, I think.
Thanks, Jen. Thanks, Chair, and thank you, Mayor. So the only thing I would add, really, we did include in the paper the proposed vision and objectives and some transport network principles for the board to comment on, and we have been engaging publicly on that over the summer alongside the mass transit route options consultation. So yeah, welcome thoughts on that. We've tried to make the link between transport and health as clear as we can do, but welcome thoughts as to whether colleagues think we've done that enough. And we have indeed got an objective around for transport for the new LTP around improving the health of our people. So yeah, I'll leave it there. I'm happy to take any detailed questions, Chair. Thank you.
Thanks very much, James, and big thumbs up for your screensaver. Screen back shot. Yeah, so for any questions or comments, Sarah. Yeah.
Hi, good afternoon, everyone. I'm Councillor Sarah Ferriby from, and I've got the portfolio for healthy people in places in Bradford. I'd like to thank officers for this report. It clearly links the importance of transport to health, and that's one thing that I think people just sometimes think it's all about transport, but it's actually that wider vision that good access to transport opens up a whole myriad of opportunities, not only jobs, but also to those doctor's appointments or the wider access to appointments for medical services. And I think as we're all shifting towards using various modes of transport, this report also looks at the environmental impacts. And as you all know, in Bradford, we implemented a clean air zone a few years ago. Now, obviously, there's data lags, and I know that the Born in Bradford NHS Research Institute are pulling together the information for the last 12 months. But I know the first 12 months that we saw improvements in air quality and the reduction in NO2 gases. And actually, the reduction in those gases has such a positive impact on people's health, and usually in those areas where people have health disparities, that they have poor access to health services and maybe doctors, and it's that positive impacts, and also it links into the reduction of needing to go to hospital because you're breathing better air, and I think actually linking all that together in the transport plan, where we're going for that modal shift that we all want to be fitter, we want an improved environment, we want to have access to good public transport to get from A to B, and that takes us from a shift from always relying on the car. So I welcome this report. I welcome the transport plan because it has such a knock-on effect to so many other things, whether that's your employment, your health, your access, and it's so important for all of our communities, whether that's in Bradford or the wider West Yorkshire family of people who are accessing services and actually want to improve our health. So thank you very much.
Thanks, Sarah. Faluki?
Thank you, Chair. Yeah, just building on what Councillor Farabee said. By the way, I'm Faluki Ajayi, Chief Executive at Airedale NHS Foundation Trust. So really welcome this report. I think there is something about the detail in there about how do we facilitate access to anchor institutions. The irony for us is that, as Rob has already alluded to, we have the opportunity of building a new hospital, but one of the key features that we're starting with is building a new car park, because at this point, access to our hospital is not great either for our patients or for our colleagues who come to work at Airedale. And ideally, we would want to have alternative means of people getting to the hospital, but it's just not realistic at this stage. So it'd be really good to understand how we build some of the thought processes into this, so we facilitate access for users of the site in terms of whatever it is that brings them that enables that access. Because we talk about access a lot, but actually we may make our services accessible, but if people can't get there, then actually it's not accessible. Thank you.
Thank you. Fatima.
So for Lukey is a beautiful segue for what I wanted to say, which is one of the key elements that we've picked up from conversations on transport is the importance of being able to reach health and care services. So, for example, if you're living in Calderdale, because James is clearly in Calderdale right now, and you want to get to a tertiary site in Leeds, the transport isn't direct. And if you're somebody with a disability and physical access needs, that makes life all the much harder. So completely echo and want to support Lukey's point. My sort of question is more to the health and care partnership leaders and sort of what is our role as organisations and anchor institutions when it comes to supporting the people that we employ with that behavioural change of getting public transport? Because it is so easy, isn't it, to get in the car and get from A to B, especially if you're a woman that has a number of chores to do en route and the buses don't always take you exactly the route that you need to go if you've got, say, caring responsibilities or childcare pickup, etc. And then the other bit, which James and I have had a conversation about, is the importance of safety on public transport as well. So one of the reasons why many of our colleagues don't want to use public transport is because they've either experienced sexual harassment or they've experienced racism while using transport. So Tracy and I have been doing lots of work on the influence we've got through the policing and crime of encouraging people to report such entities. But there's also something about how we as a community through our anti-racist agenda really promote this and encourage people to feel safe when using public transport.
Thank you both. A couple of comments. Certainly all the access point to health are very well made and continue to be an issue. It used to be a slightly ironic point I made when I used to work for Age Concern, that you talk to older people about health and you ended up spending a significant part of the meeting talking about transport and the problems with getting there. And I think it's important to recognise it's not just hospitals. Often I don't know whether it's unique to Calderdale, but we're finding that as primary care organises it more into clusters, those clusters don't always reflect natural transport routes and can be quite challenging for access to. I think perhaps the other, the other point is picked up in the paper, but I think the more we can do to strengthen the arguments around different forms of transport, around the health impacts, are really important. People have already mentioned the clean air zone. I think that whole issue of the impact of air quality and the contribution of transport to poor air quality and the health impacts of that is important. And of course, also, we mentioned earlier in the meeting the previous discussions we've had about Vision Zero, and again, appreciating that one of the many negative impacts of road safety is the huge costs it imposes on the healthcare system as well. So I think there's some really important points we can work together with. I know some of those will be being picked up by the work that Frank is doing around climate change, but wider as well, making sure we're very clear about the costs and the negative impacts if we get transport wrong. Perhaps also helps to strengthen Wicker's hand in countering some of the unfortunate kind of knee-jerk pro-motor comments that you sometimes get whenever you discuss transport as well. Are there any other comments, James or Jen? Anything you just want to respond to?
I think, well, first of all, thanks very much for those really helpful comments. We'll take those away, and it'd be good to actually either come back or have a more in-depth discussion with health colleagues about the ongoing development of the LTP, because as you can imagine, we're taking all this feedback from the engagement over the summer and starting to turn our attention to actually putting the relevant policies together and an associated implementation plan. So it'd be good to sort of talk that through over the coming weeks and months before the formal consultation, so that when we go out in the spring, we've got the right ingredients in there. And I should add that obviously we'll see what happens on October the 30th, but at the moment West Yorkshire has an allocation of about £2 billion into the next transport funding settlement. That may or may not change in a week and a half's time, but a big slug of that is due to go on the new mass transit system. But still, there's still a significant amount of money there which we need to start to shape, working with our partners around the different how we're going to spend it and achieve the outcomes we want to, including on transport and health. So, bit of a heads up there. But no, thank you very, very much for the comments.
Thank you. Yeah, and I'm sure we welcome that ongoing opportunity to contribute. Okay, thank you very much, everyone. So, final item is the West Yorkshire Equality, Diversity and Social Justice Strategy, and hand over to Fatima and Ali to introduce this item. Fatima.
Thanks, Chair. Clearly, we've been using this agenda to build anticipation for this final agenda item, and we hope that the wait was worth it. Ali, do you want to introduce yourself before we begin?
Yes, hi everyone, good afternoon. For those who don't know me, my name is Ali Bishop and I'm the Equality, Diversity and Inclusion Transformation Lead at West Yorkshire ICB. So nice to meet you.
Thanks, Ali. If you want to pull up the slides, I'll just quickly do a brief introduction of how we've ended up here and why this conversation and the contributions of Partnership Board colleagues is so important to the work that we're doing. So I think most people, if you ask them, could give you a very articulate narrative or elevator pitch about why having a vision for equity and social justice is so important. The reason why Rob Webster and colleagues in their wisdom have taken the initiative of creating a vision for the West Yorkshire Health and Care Partnership, I think has been demonstrated by every single agenda item we've had today. Equity and social justice cannot be fixed in isolation in a health and care partnership. There are significant influences and wider determinants that we need to work cross-boundary on to truly make West Yorkshire a region of equity and a place where everyone can access high quality and safe services in an equitable and inclusive way. And the reason why it's particularly important is because if we have an inclusive workforce, then we can ensure that the services we deliver are much safer, that we are much more productive, but more importantly, the people that use our services have the best experience possible. And why would we not want that? I think one of the things that we would need to really recognise, though, and the data speaks for itself, is that there is a significant challenge when it comes to not only the experience of staff people working in our services, but also people that utilise our services cannot escape the disparities that currently exist in the way in which we deliver services or the way in which we deliver the best outcomes. And I only need to take you back a couple of years ago during COVID to show that that was magnified intensely and no one could escape that. However, I have come to one conclusion, and people might disagree with me, so please feel free to interact in the chat if you do. But the conclusion I've come to working with Ali and other colleagues on this agenda is that for us to truly succeed in this vision, we've got to recognise that equity and social justice is in everyone's interests. And if that's going to happen, then we need to make it everyone's business. And it's a bit like HR and people management. And I keep looking at Kate Sims when I say this, because she's a fabulous leader in that agenda. But it's a really great analogy because good people management is everyone's business. And if we truly want to deliver inclusive outcomes, then we need to help people realise what their role is in that landscape for making it a reality. We wouldn't be doing this right or in the ways of West Yorkshire if we didn't link it to the mission and values and behaviours that we've all signed up to, but also in a way that enables us to deliver our 10 big ambitions in a way that is truly inclusive, and also working very, very closely with the forthcoming people strategy that will be coming up very, very soon. I think the other thing that we have to realise, though, when we've talked about this quite a lot all the way through the meeting, is recognising that the health and care system is under significant challenges. We only have a finite amount of resources, and there's only so much we can do with the work and the people that we currently have. So there may be an element or a conversation we need to have about how we prioritise our efforts to ensure that the outcomes we deliver are both consistent, but the most impactful we can in the values of West Yorkshire. And in order to make that happen, if you move on to the next slide, please, Ali. We've tried to develop a process by which to do it. Now, I'm someone who's a very visual Ron Seal girl, for those of you that are familiar with the advert, which is I like to do exactly what it says on the tin. And one of the first things was a very much a co-creative approach where we had lots of conversations with people because they were really helpful in giving us an insight as to what is going on in West Yorkshire and the grassroots of our communities, really making sure that we didn't come in with an expectation or a perception of what the answers were going to be, because that's not true co-creation. But what we also wanted to do was fully understand the situation before we decided what to do about it. And in order to fully understand the situation, we've got to use the best data and one version of the data to understand the truth. And we very much did a sort of a triangulation, which I'll talk you through very shortly, to identify that. If you go back, Ali, don't steal the thunder just yet, because there's another element I want to cover before we do. And then the final bit was, once we've had the conversations, and this is very much learning from our incredible colleagues in engagement particularly, is not assuming that we've reached everyone once we've had the conversation once. So what we did was we looked at who we've spoken to, we then identified who the gaps were, and then we were a little bit radical with the next phase of the conversation. So we did something crazy like a live webcast, which was a bit risky, but we had some really interesting conversations and people coming to it, and it was a very unstructured conversation. And then what we're hoping to do, because we're still on phase 2 and we'll share details of how you can all contribute to that, will be how we then draft what we hope to achieve and what everyone's role is in supporting us to get there. And that's kind of why we've come to see you all today. So if we move on to the next slide, what we've tried to sort of articulate through the paper is a process of sort of a triangulation of a number of sources. One is very much listening and acting on the feedback of others. The second one is going through lots and lots of data. So things like the Workforce Race Equality Standard, the Workforce Disability Equality Standard, information from the staff survey, and information through engagement mechanisms that we've already got. We also then measured that with what we have to do. And through that triangulation process, taking into consideration what we're already doing, we're hoping to now propose some high impact objectives that we wanted to sort of socialise with you. But we thought that process was really clear, because if we're going to start to prioritise what we're doing, we need to be open and transparent about the process we went through to get there. So if we move on, this sort of word cloud, for want of a better phrase, just articulates some of the words that I thought were really powerful in the engagement process. And a huge thank you to Paul Hemingway and his colleagues in the comms and engagement involvement team for facilitating this. I mean, there are some significant words which I'm not going to read out to you that are really, really quite powerful. But I think the one that I think is important for us to recognise is that not feeling like an inconvenience. And the reason why I wanted to draw attention to that one in particular was, as we'll discuss, we're about to undertake an evaluation of the Donna Kinnair review. And one of the lived experience stories that we had as part of the first sessions was about people with lived experience from being from ethnically diverse backgrounds, not wanting to take the space, not wanting to be a problem, not wanting to cause a challenge. So that was a very, very powerful comment. If we move on to the next slide, the other elements we tried to sort of thematically demonstrate in a way that really reinforces some of the language that we heard in that video from the maternity voices. You know, kindness does not have a language, absolutely, just as everyone has a role in ensuring fairness and social justice, and that actually there's a real opportunity for us to not only listen to people's lived experience, but to also act on it in a really impactful way. And one of the things that we've not really talked about so far in the partnership board is the impact of the unrest over the summer, the impact that's had on people working within our organisations, people that are utilising our services, and our response to that, which we will pick up in the Donna Kinnair review. There's also something that I saw that made me really smile, because we always roll like this in West Yorkshire. We are courageous, we are transformational, and we are ambitious for our people. But in order to do that, the feedback has really enforced the importance of using data and people's experiences to ensure that we're making the right choices. But a real thing that came through was the importance of trust for our colleagues and trust with our communities as well. And in order to do that, there needs to be a real focus on re-strengthening that relationship that already exists, but we need to build on with not only the people that work across our organisations, but also people that are using our services. So I'm just going to hand over to Ali now, who's going to talk you through a little bit of where we've gotten to in the process. Over to you, Ali.
Thanks, Fatima. So as Fatima said, what we've done through that whole process is we're trying to identify some objectives that we think will have that high impact. We think will have that highest impact. I'm a real firm believer of the power of system working, and actually how much more powerful it is if we all work together in terms of that in the same targeted approach. So the first, there are 10 objectives as it stands at the moment, but these are draft, they haven't yet been finalised. First set are all around strengthening our relationship with our communities. So again, plays into a lot of what's already been said and some of the things I've been hearing through the rest of the meeting. But all of our services need to make sure we've got those processes in place in terms of truly listening to our patients and our workforce. And staff networks are a really key way that we can do that. We've got to be better at gathering that data and that data around equality, and data, how we're approaching it is data in terms of access, in terms of experience, and in terms of outcome. And we've got to make sure that there's that clear communication when we've got targeted services, or services that are targeted towards particular cohorts of people because of their either poorer health outcomes or poor access to that health. We need to be really honest and open about that. So that's one of the things we've heard back from people is, they understand when we do things that are going to be targeted. Let's be honest about it so that they're clear about it and they don't feel that the process is unfair. So then there's a number of objectives that are linked to our workforce. So there's a whole area around better understanding power and privilege. And I think that's a piece of work for all our all our staff, to be honest, but particularly in terms of our senior staff. Power dynamics have a huge impact on our relationships and on our communications. So it's really important that we all understand the power and the privilege that we have in every situation. And then there's the bit around the discrimination. Particularly, one of the things that the data has highlighted when we've looked at it is we know now that our staff with disabilities, long-term conditions have a much worse time than other staff. We've got to do better at supporting them. I think it was Selena mentioned earlier about having workforces that are much more inclusive, particularly for people with neurodiversity. So we know that we need to better support our staff. And as Fatima mentioned, there's also the work around the independent race review, and that review that will come into a bit more detail about will help kind of steer us in terms of the whole anti-racism agenda. So then there's the whole area around inclusive leadership, and that's, as I say, all our senior managers, and really understanding the work of allyship and advocacy. There's targeted work around being more diverse. We're still not representative of our population, and if we want to do that, when we need to have some real targeted recruitment programs, and as I mentioned, that might be around people with neurodiversity, obviously minority ethnic backgrounds, but also younger staff, for instance. And once we've recruited that staff, we need to make sure we've got the systems in place to support them. And then around the diversity of leadership, it's already a big ambition, but again, we've got to think of ways that we can work across the system to develop that diversity, to develop the pipeline into those positions, and to really shift the dial on this. And then finally, there'll be an objective in place just to look at, well, actually, what is it that's working? When look at the pieces of work. If they're having an impact, let's see if we can scale them up. Let's see if we can do more work in that area, existing pieces of work. But actually, if there's things that aren't having the impact we want, let's kind of readdress them and think about other ways that we might be able to approach things. So next steps, these are just draft objectives. We've got to refine them, and then we've got to make sure that they're specific, measurable, achievable, realistic, and time bound. So we'll do some work around that. We'll need to make sure then we set some ambitious targets around that, and then we need to make sure that everybody in the system, understands what it is that we're working to and their part. And I think that's the really important bit, is what their part is in that. So for those of you that are techie, there's a QR code on the screen which can take you to straight through to a survey. If you've not commented, we're really, really keen to hear everybody's voices. The slides will be shared afterwards, so you'll be able to use the links afterwards, or you can contact me directly. I'll leave an email address. And finally, we just wanted to touch, I know Fatima made reference to this, but in 2020, we had the Independent Race Review chaired by Professor Dame Donna Kinnear, where 16 recommendations were drawn across kind of 4 themes. And what Rob has asked us to do is kind of re-look at that. Let's use this as an opportunity to look at the progress over those 4 years. We've invited the original panel and some new members as well, where that makes sense, to really help us kind of look at all the evidence, assess the evidence, and help sort of redirect us, I suppose, in terms of new recommendations that will be aligned to the final strategy. Fatima, did you want to come back and say any more about the review?
So just a couple of principles that we've agreed now that we've iterated the first meeting. One is the real importance of not creating more work. This is an evaluation of the existing work that we've undertaken. And the final thing I would say is that Donna was really keen when she met with myself and Rob may want to come in and comment on this as well, that she was very keen to understand the impact on children and young people as a result of long COVID and sort of the years after COVID, and also very keen to understand the impacts of the recent unrest over the summer and the riots in particular, and how that's impacted our communities and our staff. We're hoping to do this at pace like we did previously, because real change happens in real work, doesn't it? And we're hoping to get a sort of a draft outline of what the recommendations are looking like by the end of the year. But what you'll see is sort of a really coordinated piece of work where we've got a number of activities working in parallel with each other to sort of develop an inclusive vision for what equity and social justice which will look like and what it will feel like in West Yorkshire. And the reason why that's really important is because people own what they create as well. And one of the things that will always stay with us in particular is that Sheila test that we created in October 2020, which was a lady from Hare Hills who came to the launch of the review and really strongly articulated that strategic aspirations are fine, but real change happens in the grassroots of our communities. And one of the aspirations of this iteration of the review is to ensure that it is really meaningful in our places and our neighbourhoods, and that alignment is really crucial. If we just move to the final slide, thank you, Ali. It's like magical the way you read my mind then. I think there are a couple of things that I want to make sure that partnership board members have really sort of clocked. The first one is that our relationship with our communities will be crucial to the success of this vision. I think that's come across really strongly in the themes. I think the second thing is to really recognise that our people will be integral to our success, and the sort of forthcoming emerging objectives have really started to highlight those. And I suppose the final thing is we need to be better at telling the story of the change that we are making and how that is impacting the grassroots communities of our region. And we've got a number of stakeholders around this table that will be crucial to our success. So the recommendations are there and you can see that, but I have a very specific ask, because Fatima never comes to a meeting without asking for something. And that is that I need your help. And the things that I need your help with are just two very simple questions, which is one, how do we embed this? How do we embed this aspiration and this vision into a reality that permeates every single part of our system, really delivering that change that people are crying out for? And the second one is, how can we do this in the values of West Yorkshire and implement it in a really meaningful way with the principles of subsidiarity and leading from every seat, as Rob would say? I'm going to pause there, Chair, and take any questions as needed.
Thank you very much. Thank you both. Very clear presentation. So, questions or comments, please? Rob.
Yeah, thanks. Thanks, Chair, and thanks, Fatima and Ali, for the presentation. I just reinforce 2 points, I think. So I'm always grateful that we have used the race equity review from 2020 as pretty much a standing item on this agenda. And we've been able to demonstrate progress throughout the last 4 years on the things that we said we would do. And now is a good time to relook at the level of progress, be honest with ourselves where we've done really well and honest where we need to do more. And it's clear that we need to do more just from some of the data we've seen today. So 4 times as more likely to die in childbirth if you're from a black background, twice as likely from a South Asian background, and so on. So there is still much more to do. And I'm really grateful for people who are involved in the race equity review. It's also clearly the case, isn't it, that the context has changed. We hadn't had race riots and Islamophobic activity on the streets when we did the last review. We had a very different, where nobody was on the streets because we were in the middle of the pandemic. And that change in context is something we should recognise, something we should embrace the challenges of, and something we should do something about. So I'm really glad that we're doing the work now and that we're really standing up and saying this is what needs to happen. Then the second thing, in a more positive vein, I think, is that as we enter a period where we say we need to change care, we need to transform care, we've got a 10-year plan coming, we need integrated neighbourhood teams, there's an opportunity for us through the EDI strategy to change and transform those services in ways which will bring people the furthest from care who need the most care closer to care. And I know there's often a lot of rhetoric around the EDI work, but we need experts to help us to do that work well. We need to engage with the Sheilas and others of this world in our communities to make sure that we design services in the right way. So I'd very much welcome the leadership around this partnership for us to do that in that way, and to create those services in ways which are going to transform care for people who need the care the most.
Thank you, Rob. Kate?
No, thank you, Chair. And firstly, just to thank you both for the presentation. I think it was really thought-provoking, and I particularly welcome the engagement work you've already done. I thought that slide that showed all the different feedback coming together and the strength of that's really essential for this sort of strategy, isn't it? So thank you for that. I suppose linked to Rob's point that he's just said, I was thinking the same from a workforce point of view around the paper we've had from Jen and Kate earlier on. Some of the inequalities within that paper still tell us we've got work to do, not just in terms of attraction, but also the retention of staff from all of our diverse backgrounds. I think we know there's a lot of work to do. And my final thing is to the partnership board colleagues. Ali will be pleased that I'm saying this, I'm sure. I've written out to workforce leads within place, to the place workforce leads, to say that if you have evidence or that you'd like to share with the review panel, case studies, but also I think really essentially challenges as well, then I'll say this to all colleagues on the partnership board, please let me have them. I think there's some really good practice you've heard at the partnership board around things like the inclusive recruitment toolkit. Colleagues are using that or alternatives, and it'd be really helpful to hear some of those from right across the partnership. But as we have encouraged, as Rob suggested, also let's be honest about the challenges as well, so that we can move to the next stage. So that's a bit of a plug. People are welcome to write directly to me with that if they wish. Thank you.
Thank you. Brodie?
Thank you. I thought it was a great presentation, and I thought it did fulfill the kind of sense of being meaningful, being something that will progress. As you came to the end of it, I really started thinking, how are you going to make this stick? How are you going to take this forward? And hey, you've asked us that question. I think for me, it shouldn't just become another checklist. It shouldn't just become another piece of kind of data that we get on a regular basis. It would be good to see you exploding in dynamic ways the successes and letting people see what outcomes the successes lead to in terms of care, in terms of communities, in terms of what's actually happening. Sell the product for the reason that it's positive. Sell the product in that it'll make a difference, it'll improve things, it'll be decent. Sell it on that basis. Don't sell it on the basis of a grid saying, hey, you're 2 points down, you're 1 point up. It just will fall into the background music of much of other aspects that we work with. That's all I can suggest. I think that the homework you've done is fantastic. Please don't wait too much longer. It's been around for a bit as this, and it deserves to get off the starting blocks in terms of the delivery phase at a very early stage. But it deserves to be a success, and you need to promote it on the basis of success.
Thank you. Thank you, Brodie. Fatima or Ali, any points you want to respond to?
So Brodie, I think you're probably sick of me saying this phrase, but I'm a massive fan of Elvis, who always says a little less conversation, a little more action, please. And you'll see that this strategy really powerfully will articulate that. But I think your sort of response, and I think it's a really, really helpful one, is to focus on the outcomes, how it links to service delivery and how it's a positive thing. And we've always in West Yorkshire focused on the carrot rather than the stick, and we will continue to do so. I suppose my challenge back on reflection is always, This is not easy. If it was, we'd have sorted it, because that's how we roll in West Yorkshire. We're not afraid to do the hard things. There will be opportunities where we will need to have some quite thought-provoking and challenging conversations about some of the elements that will come through as a consequence of this. And we will need the support of the leadership to make that a reality, because true allyship and action doesn't happen in this board. It happens in all the stratas of our organisations. And in that way, we'll really meet that Sheila test.
Thank you. I'm not seeing anybody else who wants to comment. So we endorse the work that's taken place so far. Rob, sorry. Yeah.
I was simply going to add, Councillor Swift, and I hope the partnerships, congratulations to Fatima and to Faluki, who've been identified in the Health Service Journal today as being amongst top leaders in the country.
Oh, congratulations, very much so, yes. Okay, thank you very much, everybody. I think was the applause. That concludes that item. Thank you very much for your work on that, Fatima and Ali. And that brings us to the end of the meeting, unless anybody has any other business they want to raise. No, brilliant. Thank you very much, everyone, for your time and contributions today. Thank you.
Thanks, everyone. Proud chairing, Councillor Swift. See you all soon.
Thanks, Councillor Swift.
Thank
Thank you.
Bye now.